Okay, so I've just finished a run of night shifts in my new job, and that means on a rare day off, there is no better time to talk to you guys about surviving the on-call. Lots of you will be joining us as brand new doctors in just a short few months. We're really excited to have you joining us in the medical world, and I genuinely hope that you're excited too. The NHS is in a bit of a crappy state at the moment. There's lots of doom and gloom, but that doesn't change the fact that you are joining us in what I think is the greatest profession in the world, and we are here to support you. And in this video, I'm going to be bringing you my 5 top tips to surviving your first set of medical on-calls. Now, the first thing we really need to understand is what being on call actually means. When you're on call, you are essentially always accessible and ready to be called upon, hence the name on call. And it's important to understand that this means you are not going to normally be expected to be carrying on with your regular ward work. Rather, various wards and departments, and often multiple specialties, will contact you with requests which you should attend to as promptly as you can. As the on-call doctor, you'll be responsible for things like admitting new patients to various wards, making referrals to different specialties, dealing with acutely unwell patients and medical emergencies, and prescribing acute medications for people that need them. And you need to keep in mind that things like discharge letters, routine referrals to different specialties for workup are very much not what you should be focusing on the on-call. Those things are better managed and much more sensibly managed by the day team, by the regular ward doctors that are looking after those patients. And this also means that you must be prepared to gently push back against something that doesn't need to be dealt with by the on-call doctor. During a busy on-call, you simply will not survive if you say yes to anything. As always, we need to operate by triage. You see the sick patients first, and everything else comes second to dealing with them. More experienced nurses in general will have a much more astute sense of what needs the attention of the on-call doctor and what can wait. But we do need to bear in mind that it's not really the ward team's job to decide what's important and what's not important. Their job is usually to raise it to you as the on-call doctor if they're worried about something, and then you have to make an assessment of whether or not it's a good use of your time. And speaking of time, tip number 2 is to be on time. This means taking handover promptly and making sure that handover is swift and efficient. Usually in most settings there will be a designated window of about 15 to 30 minutes where handover takes place, and it's usually in a fixed location. So knowing where handover takes place is one of the most important things to get right. And for the on-call doctor, this is really important for 2 key reasons as far as I see it. The first is that wards will generally know when medical handovers are, and they will be much less likely to call for the on-call doctor around this time because they know that that on-call doctor will be receiving handover. If you instead arrive late, and that means the handover takes place late, then the wards may start ringing before your handover is finished. That means you're going to be interrupted, things are going to be forgotten, and mistakes can be made. And the second really major important reason to be on time is that it's a professional courtesy to your colleagues. Doctors generally cannot leave until they've handed over, so if they're carrying especially something like a cardiac arrest bleep, or they are the only doctor on call for a large area, they're not leaving until that bleep has been handed over to somebody else. So it is your job as the person taking the handover to be on time so your colleague can go home on time. Tip number 3 is a very good general life skill for medicine, and I guess life beyond medicine in general, and that is staying organised. It should go without saying, but on-call shifts can be extremely busy, particularly if you're covering a surgical specialty or something like general medicine. If you're the SHO on call, calls are going to come, and they are going to come fast. This means that keeping a tidy and well-organised jobs list and a reliable pen to write your jobs list with should be your absolute top priority. And a practical tip that I'm sure we have all fallen foul of at some point: do not ever go anywhere without your jobs list. Do not leave it on a ward, do not leave it in the mess. It should be in your pocket at all times, and when someone calls you, you write the thing down as soon as you get the call. If you do not do this, you will forget. I generally like to use a system that goes ward, bed number, patient name, to keep track of who is who, where they are, and what needs doing, and of course whether or not I've completed that task. I would recommend very heavily against using just patient name or just bed number by themselves. I would always say use at least 2 different identifiers. The more the better, really, and especially if going towards handover, having a hospital or an NHS number is also very helpful. And the reason this is important is that it makes mistaking the wrong patient much less likely. Firstly, because patients patients can move around on particular wards or even between wards without anyone telling you, so you could turn up to a given bed number and have no idea whether you're looking at the right person or not. And secondly, lots of patients can have very, very similar sounding or even identical names a lot of the time, and it is much more easy to make this mistake than you think. By using at least 2 identifiers when you're writing things down, you are much less likely to make a mistake, especially if you're handing that information over to somebody else. And lastly here, I also find it useful to keep track of timings. Have you referred to another specialty or requested a scan? Record the time that you've done these things, because again, not only is it useful for handover, you can say I requested a scan and discussed it with the reg at this time, and it's now 3 hours later. You might need to chase it up. It also means that in the event that something goes wrong and that communication chain breaks down, you've got documented evidence of exactly what happened when, and you are protected. But it's time to take a quick break and talk about today's sponsor, Brilliant.org. Brilliant is a fantastic and modern problem-solving website that offers interactive video courses to help build your critical thinking skills and scientific understanding. The website is designed to teach you how to think like a scientist, engineer, or mathematician in a fun and challenging way. With a wide range of courses available, there's something for everyone, whether you want to improve your problem-solving skills or simply learn something new. I am genuinely having to get to grips with AI, machine learning, and neural networks in preparation for my new job that I'm starting this summer, which I'll talk to you about another time, and Brilliant, as ever, has a class for that. It really does have something for every student at every level, accessible from the cloud wherever you go. To try everything Brilliant has to offer, free for a full 30 days, visit brilliant.org/Ollie Burton or click on the link in the description. The first 200 of you will get 20% off Brilliant's annual premium subscription. And huge thanks, as always, to Brilliant for being brilliant by sponsoring today's video and supporting the channel. Bringing things in for tip number 4 today, it is make friends. Now this one is a bit more of a matter of personal preference, and it's not necessarily something that everyone watching will agree with, but it's something that has worked well for me, and so I want to talk about it today. What I do at the start of an on-call shift is I find out a list of all of the different areas and wards and departments that I'm covering, and I make contact with each of them at the start of the shift. Whether that's making a phone call to each of them, or I prefer to go in person, go to the ward myself and show my face. I'll go and find a member of the nursing team, introduce myself. Hi, my name is Ollie, I'm the SHO covering you this evening. This is my bleep number or my decked phone number, and make sure they've got it written down somewhere. And then, are there any sick patients that you think I should know about, and are we expecting any new admissions to the ward this evening? And to me, this has several advantages. The first, obviously, is that you've shown your face, the ward knows who you are, they know that there is someone there looking after their patients, they know they can call you. I think that provides a nice sense of security. And secondly, obviously I find out early if there's someone sick that I should know about. I can keep an eye on them remotely, I can have a bit of a read, and it means that I'm not surprised if I get called about them later. Now obviously take this with a bit of a pinch of salt. It depends on your workload. It may not always be possible, but if you've got the time to do this, this is an approach that has worked really well for me. And it also means that you can get things like your 360-degree behavioural feedbacks or your tabs, things like that done, because the ward team know who you are. It is much easier to get feedback when you've been proactive, you've been helpful, and you've shown that you're accessible. And then lastly, tip number 5 to close things out is do not be afraid to ask for help. Especially at the beginning, if you're an FY1 doctor, on-call shifts can sometimes feel like a whirlwind. You will have some pleasant ones here and there, but in challenging specialties, if you're working in things like general surgery, for example, they can often be a bit of a relentless onslaught, and it is easy to become overwhelmed. And it's important to try and recognize that nobody is kind of out to get you, but ward teams will not always understand the pressure that you're under. For many people, completely reasonably, their world ends at the ward door. They are responsible for their patients, but they often don't remember that you are looking after many wards, many of which will have patients much sicker than theirs. As I've said before, their job is to escalate things to you as the on-call doctor. Your job as the on-call doctor is to process all of that information, organise it into acuity and importance, and deal with it as such. And just fall back on your training here, right? If everything becomes too much, and often it will become too much, if it's something you can't handle, you need to be escalating up the chain of command, either to MedReg, specialty registrar on call, or even if you need it, the consultant on call. They sometimes be a bit grumpy, often don't like being called, but that is your job. If something is beyond you, your job is to escalate until the problem gets fixed. And you can call for help laterally as well. This is something that I think people often forget. Often it will simply be a list of simple jobs, such as things like catheters, cannulas, blood draws that need doing, things that you're very capable of doing, but there's just so many patients that need to be seen. You can go laterally, call the other SHOs, the other FY1 doctors, and often a simple bleep or a call saying, look, I'm really sorry, I know you're busy too, but I'm getting overwhelmed, I need help. 99.9% of the time, your team members are going to be more than happy to help. So that's where we're going to wrap this video, guys. Thank you for watching. Please be sure to hit that like button for me, leave a comment, subscribe. You'll find the full article linked to my website, ollieburton.com. Don't forget to subscribe. And if you've got any questions or thoughts about the on-call, leave them down in the comments section below and I'll get to them as soon as I can. Take care and I'll see you next time.